The Moore Children's Heart Center here at Lucile Packard Children's Hospital is designed to be a comprehensive program for the care of children of all ages who have both structural heart disease as well as acquired heart disease. It's a place where discovery and innovation is blended into everything that we do in our clinical care of children with heart disease. We always consider ourselves a place that wishes to take on the most difficult cases because we feel we have the ability to do that. We have all the resources, and we also have the desire here to learn and to innovate.
The Children's Center really is three-pronged: the basic science, the clinical outcomes, and the service line or basic clinical component of the center. And all three of these areas work together to provide the best care for our patients, as well as to address innovation, creativity, and try to make an impact on the field over the next coming years and decades.
The first heart transplant in the United States was performed here at Stanford in the late 1960s. We have a long-standing program in pediatric heart transplantation, heart failure.
We have a number of specialized programs: our pulmonary artery reconstruction program, our single ventricle program, our bloodless surgery program, our transplant and mechanical assist device program, manifestations of connective tissue disorders, as well as a number of others. Our clinical program addresses the entire spectrum of congenital heart disease, regardless of patient age or circumstance. We have a strong focus on fetal cardiology, fetal management, neonatal surgery, with a big focus on premature and low birth weight infants, which are often the most challenging cases that we see in our field.
I believe what sets our program apart is really that we have been able to bring together a group of very well-trained and very talented experts in the entire breadth of heart disease in children. So many of our pediatric cardiologists here not only are very well trained in general pediatric cardiology, but they also have performed additional training in subspecialties within our field. In congenital heart surgery, our lead surgeon, Dr. Frank Hanley, has devoted much of his career to one of the most difficult structural problems that we face in cardiovascular surgery. Dr. Hanley has been a pioneer in a technique called Unifocalization for children that are born with severely malformed, or in some cases, even missing pulmonary arteries. He's developed techniques to reconstruct the blood vessels to the lungs that allow children to have decades of life in front of them with good cardiac function, especially for the right side of their heart, which is threatened in these diseases.
Additionally, we deal with a number of other complex structural heart conditions, such as congenitally corrected transposition. We've developed very specific techniques for the double switch, which we think are very beneficial for our patients. So utilizing this innovative form of the double switch operation, we actually can enhance or improve the quality of life for many of these patients. A final area where we've developed techniques which we feel enhance outcome is in single ventricle heart disease. We perform essentially all of our bidirectional Glenn procedures and essentially all of our Fontan procedures without using cardiopulmonary bypass. So we perform a no-touch technique on the actual heart itself. We perform off-pump extra cardiac conduit Fontans. Looking back over our data set, I believe we have not performed a fenestration in any of our Fontan patients in the past 10 years. By avoiding the heart-lung machine, avoiding cardiopulmonary bypass when we do the Fontan, we avoid completely those transient but very critical early post-operative physiologic perturbations that often make Fontan patients struggle and require a fenestration in order to get through that early period. Within our clinical program here at Lucile Packard Children's Hospital, we have a very high acuity for our average patient. So we have a very complex mix of patients. This is because we have a very high rate of referrals from outside institutions for some of the very specialized programs that we've developed here at Lucile Packard Children's. 30 to 40% of our patient referrals come from outside our local catchment area.
And the volume of surgery, the amount of experience that we've accumulated here is a critical factor in achieving the best results. Our overall outcomes are outstanding, with more than 97% of the children who come here for cardiac surgery surviving and being discharged to home. That, I think, is a reflection of our experience, the volume of our program. We're operating on typically 600 to 700 children a year, as well as selected adults. And that experience and that collective expertise is what allows us to achieve these outstanding results despite the complexity that we take on as an institution. I'm particularly motivated by the opportunity to help those children achieve a healthy life that could span many decades of time. The potential to live a long and healthy and rewarding life is something that all children have. And if I am able to assist those children who have significant problems with their heart and blood vessel system, their vascular system, I feel that I am really making an impact that can be a lifelong impact on those children.